Hello, everyone. I'm Theo Harvey, CEO of SynsorMed, and thank you for joining this recording and session in regards to what's happening with mental health in the Black community. This is a special time to kind of talk about this, and I was fortunate enough to get Dr. Jessica Isom on board to discuss this in a frank and honest conversation why mental health is needed today. So, Dr. Isom, if you want to introduce yourself and talk to everyone about your role and your day-to-day life.
Sure. Yeah. Thank you for having me. So I'm a psychiatrist, which means I'm a physician that specialized in treating patients that have mental health struggles. And I did residency at Yale School of Medicine. I just moved to Massachusetts to start working at Common Square Health Center. And Dorchester, Massachusetts is a demographic that has lots of Black and Brown people. And I was particularly interested in serving that population, so I'm very happy to be there. And very excited about the opportunity to talk more about how the mental health field can be more useful to Black patients specifically.
No, thank you. Thank you. I appreciate it. So, I think for a long time there's been a stigma with mental health in the Black community. Maybe you can talk a little bit about why that is and, give some of your understanding of what's resistance for a lot of the Black community for getting a mental health that they perhaps may need.
Mm-hmm. Yeah, I think one big thing to consider is what kind of representations are out there, and what kinds of people are shown to be those that have struggles with mental health and access traditional services. Traditional meaning coming to see a psychiatrist or psychologist or a therapist. And often we're not shown as people that do that on TV and movies and things like that. So we don't see ourselves as people that are deserving of those services. I also think historically, the Black community in particular has had some discriminatory experiences in their attempting to access services that has contributed to really pass down oral histories about what it might mean if you were to say, hey, I'm having some struggles and I need some help. So that's sort of like the system aspect of this. I also think the Black community has been shown to be one that enjoys non-traditional ways of addressing their mental health. So that includes faith communities, holistic practices like herbal medicine and things of that nature. So I think in a way, the mental health community needs to adapt to being more inclusive of honoring those traditions and respecting those traditions. But my job as a psychiatrist when I meet patients is to basically communicate that they are deserving of treatment, that there are things that we can offer that can be very helpful to them for dealing with everyday sorts of stuff. Like, how do I manage the stress of raising children? How do I manage race-based trauma from just existing in the United States of America? How do I manage anxiety about riding a bus? All of these average person daily experiences sorts of things are things that I talk about with my and sort of partner with them in offering resources for those things. And destigmatizing the fact that you're seeing a psychiatrist is huge too. So I'll have some patients that break the rules. So their mom might have said, don't go see that psychiatrist. And they come and see me. And then they have a positive experience. And then they might go back and tell their parent or their brother and sister and say, hey, I actually, found this to be a useful thing. So I also believe the more people that access the traditional services and have more positive experiences, the less stigma there will be out there in the community.
No, thank you for that. So, obviously, I can talk a little bit of my personal experience. Obviously, raised in the church, that was the way to kind of, help communicate, maybe your sins or any issues that you may be having. But it's funny is as I've grown older, it seems like, especially in the Black community, the church can be such a big part of that. It seems like the church has even embraced that even more with the mental health, the need for mental health, and saying that there are ways that you need the healing that you need. So I'm so glad that, they're seeing more progressive thought around that, especially in the Black community. When previously it was just, go to church on Sunday, you'll be okay.
Right, which isn't necessarily true for everyone, which I think it's important to acknowledge the nuance of that. So some people can go and get that spiritual healing and be absolutely fine and feel nourished and restored by their faith community, and others need more support, and that's okay. I also think one of the reasons why there's more of a progressive regard for mental health services is because we have been more willing to do partnerships. So there's lots of faith-based community partnerships with traditional mental health care that allows that crosstalk to happen, so we can adapt our services to make them more, relevant and applicable. So there's, even with the American Psychiatric Association, like a faith-based community resource guide that I've used as a psychiatrist in a church setting to kind of talk about mental health. So that's an important aspect of things too, more recently.
Oh, thank you for that. Right now there's a lot of things going on in the Black community. Obviously, COVID-19 is pandemic. Really, a lot of changes to behavior. Obviously, economic anxiety, and then more recently the tragic deaths of African American men due to police misconduct and brutality. As a Black man, I've been pulled over by cops before, but be honest, in the last couple of years, I felt a little bit more anxiety. It's low level anxiety, and as Black men, sometimes we don't communicate that. We don't know if we're suffering from an issue as we talk, to folks, and maybe hold it in, or we may self-medicate. So what are the signs, that we can kind of say, okay, maybe I do need assistance? Because sometimes, especially as a Black man, I may not be in touch with what I'm feeling exactly, but I may lash out, or may, look to, understand, the ways to kind of cope with it. But what can we do to kind of understand, what's going on with us internally so that we can get the help we need?
Yeah, I think a great place to start is just paying attention to your body, because your body essentially communicates how you're feeling. So if you have existed most of your life with tension in your body, you might think that's normal, but it's actually not. We are all deserving of an opportunity to kind of walk through our day-to-day and be able to relax. So if you notice that you're carrying tension in your body, that means your shoulders are always scrunched, your muscles from head to toe are kind of always tense, because you're dealing with all of those race-based traumas related to being poor in America, and all those challenges, and also the stress of not being seen for who you are as a person, which is something that Black men deal with in particular, misrepresentations in media. But walking around with all of that might seem like the normal, but it's actually not. So there's one exercise that people do when they're dealing with anxiety called progressive muscle relaxation, where they actually pay attention to different parts of their bodies. Like, they start with their fingers, and they contract their muscles, which means form a fist, and then they relax their hands. And you can tell the difference at that point between tension and relaxation. And if you tried that in your shoulders, your legs, your feet, your back, you would see the difference. And then that could be a clue for you as you move throughout your day to be able to tell, am I relaxed right now, or am I pretty anxious? It does come out in different ways. So you might be snappy at people. You might be more irritable. You might feel more on edge, especially when you're out in public spaces. Your sleep could not be great. And you also might find yourself relying on self-medication, as you've described. So some people will say, to get through the day, I have to smoke weed. That's the only thing that helps me relax and calm down. And that behavior is in response to a stress reaction that hasn't really been addressed. Drinking is another common self-medication thing as well. So I think just paying attention to your body, how it's navigating the world, can be the first clue. And a lot of what we talk about in therapy is using your body as a tool for understanding ways that you might address some of that tension and just access a better experience, a better quality of life by applying some skills. So progressive muscle relaxation is one place to start to get a better understanding of kind of how your body moves through space and how it might be communicating to you that there's something that's not quite right.
No, thank you. That was great. You just brought up a couple of interesting ideas around what can we expect in therapy. So if we start a session, will we see immediate results, or does it depend? I mean, everybody's individualized. I guess, just the fear of the unknown, right? Sometimes if we go in and we tell our secrets, can that be used against us, right? So it may be, how do you dispel some of those myths that we may hear about, psychology, mental health?
Yeah, so the first thing would be considering like the kinds of questions that you might ask as you're searching for a person. There's a trend for feeling disempowered, which means I'm just going to take what I can get. However, you know, you are using your coins, whether it be through your insurance company or through cash pay, to access the service, so the service should be appropriate for you. So you might ask questions like, are you the kind of therapist or psychologist or psychiatrist who understands how my Blackness affects my mental health, how racism affects my mental health, how poverty affects my mental health? So you kind of put the onus on them to explain why they are a good fit for you. So that's the first step. And then once you get there, it can feel quite awkward because you are, you know, expected to divulge very personal things about yourself to this person. But they're not your friend, they're not your family member, they don't know you. So it's actually a very special opportunity to present yourself in all of your authentic ways. And they take it at your pace. So if you at any point are saying, you know, I don't want to go there, I don't want to talk about that right now, they'll respect that. They're supposed to, because the goal is for you to share things as you feel more comfortable. And confidentiality is a huge thing, especially for the Black community. So patients will often ask me, am I going to tell their business? Is my medical record going to be safe? And I think people underestimate how many legal protections there are for your personal information. So the only thing I can tell other people about you is if you represent someone who's about to harm themselves, for example, harm someone else, or you're so ill that you're unable to take care of yourself completely. Separate from those three things, your information is private and stays between you and your therapist, unless you give us permission to share it with other people. So.
No, thank you for that preview of what that could mean. Holistically in society right now, are you seeing, especially in reference to the Black community, more PTSD, or are there certain things that you're seeing over and over again because of, you know, some of the things that we're seeing now, experiencing now, were racial injustices and, you know, the economic anxiety? So can you give me a sense of what are you seeing more of over the last, you know, couple of years, or what has the research told you when it comes to mental health in the Black community?
Yeah, so we definitely have a lot of those similar experiences as far as like depression, anxiety, PTSD, things of that nature. Also, more serious mental illness like schizophrenia and bipolar disorder. The differences might be in what kinds of stress contribute to people needing to present to like a person like me, which means that it's going pretty not well for you. So for PTSD, for example, you'll see a lot of people who've been unfortunately exposed to the trauma of being incarcerated. There's also the trauma of chronic stress related to poverty. So not being able to feed your kids, not being able to control how you show up for work and when you show up for work. And that kind of helplessness can produce lots of anxiety and depressive symptoms. You also see people specifically referencing what's on the TV right now as far as that racial violence towards Black men and Black women and kind of what that means for themselves. So I've more recently seen people talk about having nightmares of their children being harmed related to basically a flaring up of their other PTSD related to what's going on right now. You know, there's a sense in the Black community that we don't have these problems, but it's not true. The data doesn't support that. We do. It's just there's a little bit more hesitancy to access the mental health system. And that's good for good reason, because the mental health system is not always prepared to receive us. But I don't want anyone to walk away thinking that we are less in need of some support as it relates to mental health issues, because the data just doesn't support that.
Mm-hmm. Mm-hmm. Would you, and this gets into like, you know, how do you go about the process of finding someone? You kind of hinted at that, but, you know, maybe a little bit controversial, but would you recommend, you know, the Black community seek, you know, Black professionals that maybe have a better understanding and a willingness to understand their pain more? I know there have been studies around sometimes individuals that are medical professional of a different racial background may not understand the pain that's coming from their Black patients. So maybe you can talk a little bit about that and what your thoughts are on that.
Yeah, I mean, I'm Black first, a psychiatrist second, so I've accessed services myself and have tried to find you know, a person that looks like me. It's just not, it's not easy. So the numbers show for psychiatrists, Black psychiatrists are about 2% of the entire field. For psychologists, I believe it might be 2 or 3%. who do therapy. And then there's also social workers who do therapy. And I think we might be 4% of those. So the chances are just not great that all of us can access a provider that looks like ourselves. However, if you can, it does represent a good opportunity that, you might actually encounter a therapy situation where they do appreciate your history, and they do appreciate the present day stresses related to being a Black person here. So I think it's always a good bet to try. I recognize where I work that all of the patients that see me, I might be the only Black psychiatrist they ever see in their lives. So that's, part of the reason why I intentionally sought out a location where there's a whole bunch of Black and brown people there. But a large part of what we need to do and are actively doing is helping the non-Black psychiatrists, psychologists, and social workers to do a better job. So there are efforts to increase their competency around working with Black patients, and you can find some who do us right. And that's why I think it's important to ask those questions in those situations, just to do like a litmus test and check and see if you're with one of those white or Asian or some other racial ethnic group therapists, just to check and see if they kind of know how to treat you well. So.
No, that was very great and insightful. So any last minute thoughts or questions on, how we should go about, like you mentioned, how, is it okay to switch? It's like how, if you go down a certain path, you're not feeling comfortable, it's okay to switch. How does that affect your therapy? These are, questions I've answered. I wanted to know for myself is just, if you're going down a certain path, how does that work? Are you feeling comfortable? Talk us through maybe our journey of starting with, seeking someone and then understanding how we should, how should that relationship should progress? How should we know this is working? Give me a sense of that process.
Sure. I mean, I have patients that see me, lots of them, and at the end of the visit, they will say, I didn't know what your vibe was going to be, but I like your vibe. And basically they're communicating, I'm going to come back, because what they're talking about is rapport, like the connection that you have with your therapist. And we call that therapeutic alliance. The therapeutic alliance is what drives the treatment to be successful. So if you don't have a good alliance with your therapist, the treatment's not going to be as successful. So definitely paying attention to whether or not it's a good match is important. And I tell people it's just like dating, actually. You meet a person, you see if you're a good fit. If you are a good fit, you kind of do a few more of those dates and kind of see how things blossom over time. It's not romantic. That's the main difference. However, the sort of like testing things out is very similar. A lot of patients will say, I'm not feeling my therapist, but I don't want to hurt their feelings. And I tell them it's not about their feelings. It's about whether or not you're getting the appropriate treatment. So if you feel that the relationship is not working for you, you should feel empowered to try someone else. And some people have that option where they can just kind of hop around and find different therapists, and some people don't. So I think the first step, if you're feeling that there's something that's not quite right, is actually to say that. Therapy is supposed to be, again, similar to a relationship. You have to express when things are not working out, and then that represents an opportunity to see if it's fixable or not. And if it's not fixable, that might just be more of a communication that you need to find someone else. I've had therapists that did not work out for me, and I went and found someone else that was a better fit for me. So it's so important to feel empowered to find the right fit, because that will determine how successful the treatment is. Some treatments are short. They're like 8 to 12 weeks. It's a specific issue that you're focusing on, and you're done. Others are longer. They might be years, actually, of working with your therapist on issues that are really deep-rooted and have to do with how you engage in relationships with other people. I think overall, no matter if it's short or long, you should always be checking in, and your therapist should be asking you, do you feel like we're making progress? So that should be like an active part of the conversation throughout the relationship. So hopefully that's helpful.
No. And so basically the progress will be manifest itself in, like you said, sleeping better, not feeling those stressors that you did before, not needing to self-medicate. So we would actually have a physiological reaction to the betterment. So
and having better relationships. So, I mean, you can't love other people, you know, if you're having your own struggles as well as you want to, right? So you might say, I'm talking to my wife better, or I'm talking to my husband better, or my girlfriend finds that I'm just easier to be around, you know, indications like that. Or my coworkers are saying, wow, you look a lot less anxious than before. So a lot of the things that I ask people about are their relationships. Has your mom or dad or sister or brother or coworker said anything to you about how things might be different for you? Because relationships are really a core part of how we have a good quality of life.
No, that's great discussion. No, this is great. I really appreciate your time. I just want to let everyone know that this is sponsored by the SOS Council. This is a group of healthcare professionals that are looking to communicate to the Black and Brown communities around resources like mental health during this pandemic. And we're launching this Friday in the form of a survey and a doctor and patient matching system. So you'll see more information about that coming out this Friday. So thank you for your time. I really appreciate it. And we will get this information out to everyone. If you have any last minute thoughts, let us know. But is there a way they can reach you, or if they have any questions about, you know, how to receive help? Is there, I know you're on Twitter a lot. That's how we connected.
Yeah. So Twitter works if people have Twitter. So that's at Dr. Jess, Jess, Isom, ISOM, MD, MPH. That's my Twitter handle. But I also have an email. I'm happy to receive emails there. Can't be about clinical issues, but I'm happy to point people to resources. And that is JISOMUNC@gmail.com.
All right. Well, thank you very much for your time. We really appreciate it. And we'll get this out shortly. Have a great one. Take care.
Thanks. Bye.
Bye.